Heart attack versus cardiac arrest, the 3D difference. See this? This incredible, tireless engine in your chest? Every single beat is a testament to its power. But what happens when that engine starts to fail? So many people use the terms heart attack and cardiac arrest like they're the same thing, but they're completely different emergencies. One is a plumbing crisis, the other, an electrical failure. And over the next few minutes, we're going to take a mind-blowing trip deep inside the human body to see that critical 3D difference up close. Trust me, understanding this isn't just trivia, it's knowledge that can empower you to save a life. Maybe even your own. Let's get into it. I want you to imagine your home's plumbing. Water flows freely through the pipes, right? Now imagine a nasty clog that stops the flow completely. That's a plumbing crisis. Okay, now think about your home's electrical wiring. What if the main circuit board just shorted out, plunging the entire house into darkness? That's an electrical blackout. This is the simplest and honestly the best way to understand the difference between a heart attack and cardiac arrest. One's a blockage, the other an electrical failure. And over the next few minutes, we're going to take a mind-blowing trip deep inside the human body to see that critical 3D difference up close. Trust me, understanding this isn't just trivia, it's knowledge that can empower you to save a life. Maybe even your own. Let's get into it. The heart attack, a plumbing crisis. All right, let's shrink down and travel inside one of the most important pipes in the human body, a coronary artery. These arteries are the heart's personal fuel lines. They wrap around the heart muscle, delivering a constant, rich supply of oxygenated blood. This blood is what allows the heart to keep pumping day and night without ever taking a break. But over years, a silent problem can start to build up inside these crucial pipelines. It's a process called atherosclerosis. The easiest way to think about it is like rust and gunk building up inside a pipe. It all starts with a little damage to the artery's smooth inner lining. Things like high blood pressure, smoking, or high cholesterol can kick it off. Your body tries to patch the area, but this fix can turn into a nasty buildup of cholesterol, fats, and other junk. We call this collection plaque. For a long time, this plaque might not cause any problems. Blood can still squeeze by. But this plaque has a dangerous secret. It can be unstable. Its surface can get brittle and crack open. When that happens, your body thinks it's an injury and does what it's supposed to do. It forms a blood clot to seal the wound. This is the exact moment a heart attack begins. That blood clot can get big enough to completely block the artery. The pipeline is now sealed shut. Suddenly, all the heart muscle that was being fed by that artery is starved of oxygen. The medical term for this is myocardial infarction, and it means the heart muscle itself is beginning to die. The person is now in a race against time, because as doctors say, time is muscle. The longer that artery stays blocked, the more of the heart is permanently lost. So what does this feel like? The classic sign is chest pain, but it's not just any pain. People describe it as an intense pressure, a squeezing, or a crushing weight like an elephant is sitting on their chest. It can last for minutes or come and go, but the pain isn't always just in the chest. It can travel or radiate to one or both arms, the back, neck, jaw, or even the stomach. On top of that, you might break out in a cold sweat, feel sick to your stomach, or feel desperately short of breath. And it's incredibly important to know that symptoms can be different, especially for women. While chest pain is still the most common sign for everyone, women are more likely to experience other, more subtle symptoms. This could be unusual fatigue setting in days before, shortness of breath without exertion, nausea, or pain in the back or jaw. Because these can be mistaken for the flu, indigestion, or just stress, women sometimes wait too long to get help, which can have devastating consequences. But here's the key. During a heart attack, the person is almost always awake and conscious. They know something is terribly wrong. Their heart is still beating, but it's in crisis. The plumbing is blocked, and the clock is ticking. The cardiac arrest, an electrical blackout. Now, let's forget the plumbing and focus on the heart's electrical system. This system is the invisible conductor that orchestrates the heart's perfect rhythm, and it's a work of art. It starts in the top right chamber of the heart in a little clump of cells called the SA node. This is the heart's natural pacemaker. It sends out a tiny electrical spark that tells the upper chambers to squeeze blood down into the lower chambers, the ventricles. That signal then hits another node, pauses for a split second, and then zips down through the ventricles, telling them to pump blood out to the lungs and to the entire body. This happens 60 to 100 times a minute, every minute of your life, without you ever thinking about it. A cardiac arrest is what happens when this elegant electrical system just crashes. It's a sudden, total blackout. The orderly signal dissolves into chaos. The most common reason for this is a deadly arrhythmia called ventricular fibrillation, or VFib. In VFib, the electrical signals fire off from all over the place, randomly and wildly. The result? Instead of a strong, unified pump, the heart muscle just quivers uselessly. It's been described as looking like a bag of twitching worms. That quivering motion can't pump a single drop of blood. Circulation to the entire body, including the brain, stops cold. The signs of cardiac arrest aren't subtle. They are immediate and terrifying. The person will suddenly collapse. They won't respond to you. They will stop breathing normally. They might take a few weird gasping breaths called agonal breathing, or not breathe at all. And because the heart isn't pumping, there will be no pulse. This is the ultimate medical emergency. Without blood flow, the brain starts to die within minutes. Death is almost certain in under 10 minutes. A person having a heart attack is awake and in pain. A person in cardiac arrest is unconscious and, for all intents and purposes, gone. Their only chance at survival depends entirely on what you do next. The critical link. So we have a plumbing problem and an electrical problem, two distinct events, but they're dangerously connected. A major heart attack can absolutely cause a cardiac arrest. Here's how it works. The damage and oxygen starvation from that blocked artery can make the heart muscle electrically unstable. That instability can throw a wrench in the works, disrupting the normal electrical signals and triggering a deadly rhythm like VFib. In other words, the plumbing clog creates so much stress that it shorts out the entire electrical grid. This is why many people who die from a heart attack don't die from the blockage itself. They die because the heart attack triggered a fatal cardiac arrest. But, and this is a big but, not all cardiac arrests are caused by heart attacks. Cardiac arrest can happen out of the blue from other things that mess with the heart's electrical system, like a thickened heart muscle, severe heart failure, certain genetic disorders, or even outside events like being electrocuted or a major blow to the chest. A heart attack is a major risk factor for cardiac arrest, but they are not the same thing. The life-saving solutions. Your call to action. Knowing the difference is one thing. Knowing what to do is everything. Your response in those first few moments can literally decide between life and death. If you think someone is having a heart attack, they're awake, breathing, but have that chest pain, shortness of breath, or pain in their arms or jaw, your first and most critical job is to call 911 immediately. Don't try to be a hero and drive them to the hospital. Paramedics can start treatment the second they arrive. While you wait, have the person sit down and rest calmly. Loosen any tight clothing. If the 911 dispatcher says it's okay and you know the person isn't allergic, having them chew an aspirin can help thin the blood. Now, if you witness a cardiac arrest, someone collapses, is unresponsive, and isn't breathing right, the situation is 100 times more urgent, and you are their only hope. You have to act in seconds. This is where the chain of survival comes in. First, recognize what's happening and call 911 right away. Put your phone on speaker so you can talk to the dispatcher while you work. Second, immediately start high-quality CPR. If you haven't been trained, just do hands-only CPR. Put the heel of one hand in the center of the chest, put your other hand on top, and push hard and fast. We're talking 100 to 120 beats per minute. The rhythm of the song "Stand Alive" is your perfect guide. Don't worry about hurting them. You are their heart and lungs right now, keeping their brain alive. Third, use an AED, an automated external defibrillator, as soon as one is available. These machines are made for anyone to use. You open the case and it talks you through every single step. It tells you where to put the pads, analyzes the heart's rhythm, and if a shock is needed to reset that electrical chaos, it will tell you to stand clear and press a button. CPR plus a shock from an AED is the 1-2 punch that can restart a heart. Keep doing CPR until the professionals get there and take over. Your actions are the bridge to life. So, We've seen the 3D difference between the plumbing clog of a heart attack and the electrical blackout of a cardiac arrest. You now get that a heart attack is about blood flow, while cardiac arrest is about the beat itself. You know the different signs for each, and you know exactly what to do. This knowledge is a superpower. Recognizing a heart attack gets someone to the hospital in time to save their heart muscle. Recognizing cardiac arrest and jumping into action with 911, CPR, and an AED can literally bring someone back from the dead. These aren't just two medical terms, they are two very different calls to action. By understanding the difference, you're no longer just a bystander. You are the first, most critical link in the chain of survival. Share this video. Talk about this with your family. Because knowing the difference doesn't just make you smarter, it makes you a lifesaver. Seven daily habits that will transform your heart health. What if the secret to a stronger heart wasn't some huge, life-changing event, but a series of small, daily choices? Today, I'm sharing 7 simple, science-backed habits that can make a huge difference in your heart health, and you can start right now. We often think that protecting our hearts means extreme diets and brutal workout routines, but honestly, the science tells a different story. The most powerful changes are the small, consistent ones that just become a part of your life. We're going to walk through 7 of these habits one by one. And these aren't complicated ideas. They're practical steps anyone can take to build a healthier heart for the long run. Section 1. Move your body every day. First up, just move more. So many of us have jobs that keep us sitting for hours, and that puts a major strain on our hearts. A sedentary life is a big risk for high blood pressure and unhealthy cholesterol. But you don't need to start training for a marathon tomorrow. The goal is to get about 150 minutes of moderate activity each week. That's just over 20 minutes a day. A brisk walk is perfect. Studies show that even a daily, uninterrupted 15-minute walk can significantly lower your risk of cardiovascular disease, especially if you're not very active to begin with. The key is making it a consistent part of your routine, a daily promise to yourself. It's one of the best things you can do for your heart. Section 2. Adopt a heart-healthy plate. Next, let's talk about what's on your plate. It's so easy to get lost in complicated diet rules, but heart-healthy eating is actually pretty simple. Modern grocery stores are packed with processed foods loaded with sodium, unhealthy fats, and sugar, which are direct contributors to heart problems. The fix? Fill your plate with a variety of colorful whole foods. Think fruits, veggies, whole grains, and lean proteins like fish, which is packed with those amazing omega-3 fatty acids. Diets like the Mediterranean or DASH are proven to help lower blood pressure and that bad LDL cholesterol. A great little trick is to shop the perimeter of the grocery store. That's usually where all the fresh, unprocessed stuff lives. Habit number 3 is all about managing your weight. Carrying extra body fat, especially around your waist, makes your heart work overtime, 24/7. And that constant strain is a major risk for high blood pressure and other heart issues. But here's the good news. You don't have to aim for some perfect body. Research shows that losing just 5 to 10% of your body weight can dramatically cut your cardiovascular risk, and often this happens naturally when you start moving more and eating better. Section 4. If you smoke, make a plan to quit. This next one is the single most important habit for anyone who smokes. There's just no way to sugarcoat it. Smoking is one of the most damaging things you can do to your heart. It directly harms the lining of your arteries and cuts down the oxygen in your blood. The moment you quit, your body starts to heal. Your risk of having a heart attack begins to drop almost right away after your last cigarette. And remember, staying away from secondhand smoke is just as vital for protecting your heart. Section 5. Prioritize quality sleep. Habit number 5 is something we all sacrifice too often: getting enough good quality sleep.
We tend to treat sleep like a luxury, but it's a biological must. Consistently getting less than 7 hours of sleep a night is strongly linked to high blood pressure, inflammation, and a higher risk of heart disease. When you're asleep, your body is doing critical repair work on your heart and blood vessels. So try to get a solid 7 to 9 hours of quality sleep each night. Creating a relaxing bedtime routine, and yes, putting your phone away, can make a world of difference. Section 6. Master your stress. Chronic stress is a silent threat to your heart. When you're constantly stressed, your body stays in that fight-or-flight mode, pumping out hormones like cortisol. Over time, this can raise your blood pressure and damage your arteries. It also tends to push us toward unhealthy coping mechanisms like stress eating or skipping a workout. The key is to find simple ways to decompress every single day. This could be a 5-minute meditation, some deep breathing exercises, or just stepping outside for a breath of fresh air. And remember, physical activity is one of the most powerful, science-backed stress relievers out there. And finally, the 7th habit: be an active partner in your own health. So many of the biggest risk factors for heart disease, like high blood pressure and high cholesterol, are completely silent. You can't feel them, so you might not know there's a problem until it's become serious. The solution is to get regular checkups to keep an eye on these key numbers. Knowing your blood pressure, cholesterol, and blood sugar levels gives you the power to make smart decisions and catch any issues early when they're easiest to manage. Conclusion: transforming your heart health isn't about one giant leap. It's the sum of all your small daily choices. By weaving in even just a few of these habits into your life, a daily walk, a few more veggies on your plate, a bit more sleep, a little less stress, you're taking powerful steps to build a stronger, more resilient heart for years to come. The real secret is just to be consistent. Start small, and you'll be amazed at how far you can go. Which one of these habits are you going to start with this week? Let me know in the comments below. And if you found these tips helpful, consider subscribing for more simple, science-backed health advice.
Every year, millions of people around the world experience a heart attack. Understanding what really happens during a heart attack can save your life or the life of someone you love. A heart attack, also called a myocardial infarction, occurs when blood flow to part of your heart muscle suddenly stops. Your heart is a powerful muscle that pumps blood throughout your entire body. To do this job, your heart needs its own blood supply, which comes from the coronary arteries. These coronary arteries wrap around the outside of your heart, delivering oxygen-rich blood to the heart muscle. When one of these arteries becomes blocked, the heart muscle begins to die. This is a heart attack. So, what causes this blockage? The process usually begins years before the actual heart attack happens. Over time, a substance called plaque builds up inside your coronary arteries. This plaque is made of cholesterol, fat, calcium, and other substances found in your blood. As plaque accumulates, it narrows your coronary artery, reducing blood flow to your heart. This condition is called coronary artery disease, or atherosclerosis. For many people, this happens slowly over decades without any symptoms. But during a heart attack, something dramatic occurs. The plaque inside the artery suddenly ruptures or breaks open. When this happens, your body responds by forming a blood clot at the rupture site. This blood clot can completely block the coronary artery, cutting off blood flow to part of your heart muscle. Without oxygen-rich blood, that section of heart muscle begins to suffer damage within minutes. The longer the artery stays blocked, the more heart muscle dies. This is why getting emergency treatment quickly is absolutely critical during a heart attack. Now, let's talk about the symptoms. The most common heart attack symptom is chest pain or discomfort. Many people describe this as pressure, squeezing, fullness, or pain in the center of the chest. This chest pain often lasts more than a few minutes, or it may go away and come back. But chest pain is not the only warning sign. Heart attack symptoms can include pain or discomfort in other areas of the upper body. This includes one or both arms, the back, neck, jaw, or stomach. Many heart attack patients experience this radiating pain along with chest discomfort. Shortness of breath is another common heart attack symptom. This can occur with or without chest pain. You might feel like you cannot catch your breath even when resting. Other heart attack symptoms include breaking out in a cold sweat, feeling nauseous or experiencing vomiting, and feeling lightheaded or dizzy. Some people describe a sense of impending doom or extreme anxiety during a heart attack. It is important to know that heart attack symptoms can vary between individuals. Women, older adults, and people with diabetes may experience different or less obvious symptoms. Women are more likely to have shortness of breath, nausea, vomiting, and back pain or jaw pain instead of typical chest pain. Some people experience what doctors call a silent heart attack. This means a heart attack occurs with very mild symptoms or symptoms that are mistaken for something else, like indigestion or muscle strain. Silent heart attacks are still dangerous and cause permanent damage to the heart muscle. If you or someone near you experiences heart attack symptoms, call emergency services immediately. Do not wait. Do not drive yourself to the hospital. Emergency medical teams can begin treatment on the way to the hospital, which saves precious time and heart muscle. While waiting for help to arrive, sit down and try to stay calm. If you have been prescribed nitroglycerin, take it as directed. If aspirin is available and you are not allergic, chewing one regular aspirin can help by preventing the blood clot from getting larger. When you arrive at the hospital, doctors work quickly to restore blood flow to your heart. They may use medications to dissolve the blood clot. These clot-busting drugs work best when given within the first few hours of heart attack symptoms starting. Another treatment option is a procedure called angioplasty. During angioplasty, doctors thread a thin tube called a catheter through your blood vessels to the blocked coronary artery. They then inflate a small balloon to open the artery and restore blood flow. Often they place a small mesh tube called a stent to keep the artery open. In some cases, doctors may recommend coronary artery bypass surgery. This procedure creates a new route for blood to flow around the blocked section of the coronary artery. The amount of damage a heart attack causes depends on several factors. The size of the area supplied by the blocked artery matters. The length of time between the start of the heart attack and treatment is crucial. Whether you have other blockages in your coronary arteries also plays a role. After a heart attack, the damaged heart muscle forms scar tissue. This scar tissue does not contract like healthy heart muscle, which can affect how well your heart pumps blood. This is why preventing heart attacks and getting quick treatment when they occur is so important. You can reduce your risk of heart attack by managing key risk factors. High blood pressure damages artery walls and accelerates plaque buildup. High cholesterol contributes directly to plaque formation in your coronary arteries. Smoking damages blood vessels and increases your risk dramatically. Diabetes increases heart attack risk because high blood sugar damages blood vessels over time. Being overweight or obese puts extra strain on your heart and increases other risk factors. Lack of physical activity weakens your heart and contributes to other risk factors. The good news is that many heart attacks are preventable. Eating a heart-healthy diet rich in fruits, vegetables, whole grains, and lean proteins helps keep your arteries clear. Regular physical activity strengthens your heart and improves blood flow. Maintaining a healthy weight reduces strain on your heart. Managing stress through relaxation techniques, adequate sleep, and healthy coping strategies protects your heart. Avoiding tobacco in all forms is one of the best things you can do for your cardiovascular health. Limiting alcohol consumption also reduces heart attack risk. Regular checkups with your doctor allow early detection and treatment of risk factors like high blood pressure and high cholesterol. Taking prescribed medications as directed helps control these conditions and prevent heart attacks. Understanding what really happens during a heart attack empowers you to recognize the warning signs and act quickly. Remember, every minute counts when it comes to heart attack treatment. The faster blood flow is restored to your heart muscle, the better your chances of survival and recovery. If you found this information helpful, subscribe to our channel for more health education videos. Share this video with your family and friends because knowing these facts could save a life. Stay healthy and take care of your heart.
Do you want to know the best meal you could eat to help reduce plaquing in your arteries or even help prevent cardiovascular disease? I've done a lot of videos on what to avoid to prevent heart disease. Today, I'm going to primarily focus on what to eat.
We first have to give you a little background of what is going on behind the scenes as far as cardiovascular disease. Primarily, we're going to talk about plaque. What is in plaque? Plaque is a combination of calcium, protein, and cholesterol.
Many times, the calcium is the result of biofilms. So what's a biofilm?
A biofilm is a colony of microbes. These microbes build little calcium igloos or shells to protect themselves. So when you see calcium plaque in the arteries, underneath that plaquing, there could be a microbial community. Biofilms tend to accumulate on roughened edges. If the arteries were nice and smooth and strong, they probably would never accumulate.
What causes them to get stuck on the inside of the artery wall? That would be some type of lesion or oxidation or inflammation or damage.
Damage can come from excessive sugar in the diet, or if you are a diabetic or pre-diabetic. It can also come from omega-6 fatty acids, junk foods, alcohol, all sorts of things.
When you see plaquing, you're also going to see this LDL, a very specific kind, the small, dense particle size. And that's correlated too with a high sugar, high carb diet.
The cholesterol is always in a little shuttle bus. The LDL is a protein that carries cholesterol. It comes in the form of a band-aid with the cement, the calcium. Then, you'll also get a fibrous tissue, like a protein cement, that kind of mixes in with the calcium and the cholesterol as a band-aid. And then you'll see a thrombus or a clot forming too, in that same area.
Given that information, what can we do to prevent, slow down, or reverse this situation? We need to focus on key vitamins.
One of the controlling vitamins with calcium is vitamin K2. Vitamin K2 drives the calcium into the bone. Without enough K2, calcium tends to develop in the soft tissues of the body, not just your arteries, but also in the joints as well. High vitamin C foods are definitely necessary for this meal. It is crucial for keeping your vessel wall strong and preventing lesions. Also, vitamin E is very, very important. It helps prevent those lesions on the inside wall of the artery called endothelial tissue.
To avoid that lesion in the artery, it is essential to keep your omega-6 fatty acids very low and keep your omega-3 very, very high.
There are several studies that links periodontal bacteria, the bacteria in your mouth, actually ending up in the plaquing in your arteries. These pathogenic periodontal bacteria go through the pores in your gums and into your bloodstream. You might get bleeding gums. This is the same reason why bacteria can leak from your intestines. That's called bacterial translocation. So a really important thing in this meal should be omega-3 fatty acids. Wild-caught salmon. What food is very, very high in omega-3? That would be wild-caught salmon. If you include salmon in this meal, you're going to have a good amount of omega-3 fatty acids, which is going to support the arteries as well as the heart muscle itself. Having enough omega-3 will decrease your inflammation as well in your arteries, and doing that can actually lower blood pressure as well.
Now, for the most important component. This thing has like 7 times the requirements of vitamin C. It also gives you a strong probiotic effect.
I am talking about sauerkraut. It is a fermented cabbage product loaded with lactic acid bacteria. Lactic acid bacteria can act as an ACE inhibitor to help lower blood pressure. It can inhibit biofilms. It can decrease the risk of cardiovascular disease by supporting your gut. There is a huge relationship between a healthy gut and a healthy heart. Lactic acid bacteria can help regulate LDL cholesterol, especially the small dense particle size LDL. It can enhance your production of secondary bile salts, which helps the absorption of more vitamin E, vitamin D, and vitamin K2. All 3 of those are fat soluble and can greatly support the cardiovascular tissue. And it just so happens that sauerkraut is loaded with vitamin K2.
Sauerkraut is a superfood for the heart. It supports the gut lining to prevent these microbes from traveling through a leaky gut up into the heart.
It's loaded with vitamin C, giving you a tremendous amount that can directly inhibit biofilms. Vitamin C also acts as an antioxidant in your arteries, preventing these lesions or damage to the wall of the arteries.
Remember, The biofilms can only stick to an area that's roughened or irritated. If your arteries are smooth, they can't quite stick to the inside of your arteries.
Component 3, arugula. The last part of this meal is a big arugula salad. Arugula is a superior salad green because it's cruciferous. It has blood glucose lowering properties. It's loaded with something called DIM, which can help lower biofilms directly. Arugula is also loaded in potassium, which can help keep the arteries softened so your blood pressure can stay normal. On that salad, I would put extra virgin olive oil, the real stuff. It has significant effects on blood pressure. Then I would also add apple cider vinegar, but you can also use balsamic vinegar red. The acetic acid in the vinegar has many properties to help lowering the risk of cardiovascular disease. It's great for helping regulate your blood sugar and cholesterol. It can help mobilize your bile salts. And then if you add sunflower seeds, we can spike more vitamin E.
Hard cheeses are loaded with vitamin K2. Vitamin E is very, very important.
The cheese I would recommend is called Parmigiano. The American translation from Italian is Parmesan. The real Parmigiano is only produced by a collective group of farmers in northern Italy that keep their standards very, very high. The authentic Italian version is aged for like 1 to 3 years compared to some American versions. Also, watch out for Americanized Parmesan cheese, as sometimes they add this filler of cellulose, which is wood pulp.
Get the authentic type from Italy and shave it on your salad. That way you have a delicious cheese that's loaded with vitamin K2.
There's probiotics in this product. I was blown away at what they feed the cows to make sure the microbes are just right. Final component, garlic. The last thing I'm going to recommend to put on your salad is garlic. Garlic is great for the heart. It actually can thin the blood. It can help lower your blood pressure. It's antimicrobial and antibiofilm.
All right, so now that you have that information, this is the best meal to prevent, slow down, or reverse the situation. Given the link between oral bacteria and artery plaque, I think the most interesting next video for you to watch would be the one on biofilms in your mouth. Check it out.
Have you ever wondered how many eggs you should really eat in a day? For decades, eggs have been both celebrated and demonized. Today, we'll break down the science behind eggs, cholesterol, and your health, so you can make smart choices at breakfast and beyond. Let's start with the basics. Eggs are one of the most complete foods on the planet. They're packed with high-quality protein, healthy fats, vitamins, and minerals. But for years, eggs were blamed for raising cholesterol and increasing cardiovascular risk. Where did this idea come from? It started with early studies that linked dietary cholesterol, like the kind found in egg yolks, to higher blood cholesterol levels. But science has evolved. Modern research now shows that for most people, eating eggs has little to no impact on blood cholesterol. In fact, eggs can actually raise HDL, the good cholesterol that helps protect your cardiovascular system. Only a small percentage of people, known as hyper-responders, experience a significant rise in cholesterol from eating eggs. But even for them, the increase is mostly in HDL, not LDL. Let's talk about egg yolks. Many people throw them away, thinking they're unhealthy. But the yolk is where most of the nutrients are found. Choline, lutein, and omega-3 fatty acids support your brain, eyes, and liver. Choline is especially important for memory and cognitive health, and it's hard to get enough from other foods. Now, what about protein? Eggs are considered the gold standard for protein quality. They contain all 9 essential amino acids in the perfect ratio. This means your body can use egg protein more efficiently than protein from meat, fish, or plants. If you're trying to build muscle, recover from exercise, or just stay healthy as you age, eggs are a fantastic choice. So, how many eggs are safe to eat each day?
Most studies suggest that eating up to 3 whole eggs per day is safe for healthy adults. Some people even eat 4 or 5 eggs daily with no negative effects. In fact, moderate egg consumption, 3 to 4 eggs a day, has been linked to improved metabolism, better hormone balance, and even a reduced risk of stroke. Let's look at what happens in your body when you eat eggs daily. First, your body gets a steady supply of high-quality protein, which helps keep you full and supports muscle maintenance. Second, the healthy fats in eggs help absorb fat-soluble vitamins like A, D, E, and K. Third, the nutrients in egg yolks support everything from brain function to healthy skin. But not all eggs are created equal. Pasture-raised eggs from chickens that roam outside and eat a natural diet are much richer in nutrients than eggs from caged hens. They have more omega-3s, vitamin D, and antioxidants. If you can, choose pasture-raised or free-range eggs for the biggest health benefits. Let's address a common concern. Are eggs bad for your cardiovascular system? The answer is no, unless you have a rare genetic condition like familial hypercholesterolemia. For most people, eggs either have no effect or actually improve cardiovascular health by raising HDL cholesterol. Plus, eggs contain antioxidants like lutein and zeaxanthin, which protect your eyes and blood vessels. Now, how can you get the most out of your eggs? Try combining them with healthy fats like avocado or olive oil, and add leafy greens for extra fiber and nutrients. This combination helps your body absorb more vitamins and keeps you satisfied for longer. What about cooking methods? Boiled, poached, and scrambled eggs are all great choices. Frying eggs in a small amount of healthy oil is also fine, but try to avoid deep frying or using lots of butter. Overcooking eggs can destroy some nutrients, so aim for gentle heat. If you're worried about eating eggs every day, remember that moderation and variety are key. Eggs can be part of a healthy diet, alongside fruits, vegetables, whole grains, and lean proteins. If you have specific health conditions, talk to your healthcare provider about what's right for you. You might have seen stories online about people eating 3 eggs a day for 30 days. Most report feeling more energetic, losing weight, and even seeing improvements in cholesterol numbers. The science backs this up. Regular egg consumption can support weight management, brain health, and muscle maintenance. Let's bust a few more myths. Eating eggs does not increase your cardiovascular risk for most people. Egg yolks do not clog your arteries, and there's no need to limit yourself to just 1 egg a day unless your healthcare provider specifically tells you to. So, what's the bottom line? For most healthy adults, eating up to 3 or 4 eggs a day is safe and beneficial. Eggs are nutrient-dense, affordable, and versatile. They support your cardiovascular system, brain, eyes, and muscles. Choose high-quality eggs when possible and enjoy them as a part of a balanced diet. If you're still unsure, remember, nutrition science is always evolving. What matters most is the overall pattern of your diet. Eggs can absolutely fit into a heart-healthy, evidence-based eating plan. Thanks for watching. How many eggs do you eat per day, and how do you like to prepare them? Let us know in the comments below. If you found this video helpful, give it a thumbs up and share it with friends who care about their health. Don't forget to subscribe to Health Science 3D for more science-based nutrition facts and stunning 3D visualizations. See you in the next video.
heart attacks happen? Complete Guide to Myocardial Infarction, Symptoms and Prevention. 3D Medical Animation. The heart attack crisis. Every 40 seconds, someone in the United States has a heart attack. That's over 805,000 heart attacks happening every single year in America alone. In Canada, approximately 162,000 new cases of heart disease are diagnosed annually, with thousands suffering myocardial infarction. Heart disease remains the leading cause of death in the USA and the second leading cause in Canada. But here's the critical question. How do heart attacks happen? And more importantly, how can you prevent them? In this comprehensive 3D medical animation, I'll show you exactly what happens inside your body during a heart attack, why they occur, how fast heart attacks can happen, how young people can experience them, and the life-saving information every person needs to know. Whether you're concerned about your heart health or want to protect your loved ones, this video could save your life. Let's dive into the science of myocardial infarction. What is a heart attack? Medical definition. A heart attack, medically known as myocardial infarction, occurs when blood flow to a section of your heart muscle becomes blocked. Your heart is a powerful muscular organ that pumps blood throughout your entire body, delivering oxygen and nutrients to every cell. But your heart muscle itself needs a constant supply of oxygen-rich blood to function properly. This blood supply comes through specialized vessels called coronary arteries. These arteries wrap around the surface of your heart like a crown, which is why they're called coronary, from the Latin word for crown. When one or more of these coronary arteries becomes severely narrowed or completely blocked, the heart muscle downstream from that blockage begins to die from lack of oxygen. Look at this 3D animation of a healthy heart. You can see the coronary arteries delivering oxygen-rich blood to every part of the heart muscle. The blood flows smoothly through open, flexible arteries. But when a heart attack occurs, this critical blood flow stops and heart muscle tissue begins to die within just 10 to 15 minutes. This is why understanding heart attack symptoms and getting immediate medical attention is absolutely crucial for survival and recovery. How heart attacks happen, the process. So, how do heart attacks happen? The process usually begins years before the actual heart attack occurs. It starts with a condition called atherosclerosis, the buildup of plaque inside your arteries. This plaque consists of cholesterol, fatty deposits, calcium, cellular waste, and other substances that accumulate on the inner walls of your coronary arteries. Watch this 3D animation showing how plaque develops. Over time, these deposits grow larger, making the arteries narrower and stiffer. This is coronary artery disease, the underlying cause of most heart attacks. As plaque builds up, it reduces blood flow to your heart muscle. You might experience chest pain called angina during physical activity when your heart needs more oxygen but can't get enough through the narrowed arteries. But here's the critical moment. Why do heart attacks happen suddenly? The answer lies in plaque rupture. Sometimes the surface of a plaque deposit cracks or tears open. When this happens, your body responds by forming a blood clot at the rupture site to seal the damage. However, this blood clot can grow large enough to completely block the artery, cutting off all blood flow downstream. This is how most heart attacks happen, a sudden blockage caused by a blood clot forming on top of plaque rupture. Without blood flow, the heart muscle begins to die. The longer the blockage remains, the more heart muscle dies and the more severe the damage becomes. This is why every minute matters during a heart attack. How fast do heart attacks happen? Timeline. How fast do heart attacks happen? This is one of the most important questions for patient education. The answer varies significantly. Some heart attacks strike suddenly without warning. These are called sudden heart attacks. The person may feel perfectly fine one moment and experience severe symptoms the next. However, many heart attacks actually provide warning signs hours, days, or even weeks before the major event. You might experience episodes of chest discomfort that come and go, shortness of breath, unusual fatigue, or other subtle symptoms. These are warning signs that your coronary arteries are severely narrowed. How long do heart attacks take to happen once symptoms begin? Heart muscle damage starts within 10 to 15 minutes after blood flow is blocked. A typical heart attack lasts anywhere from several minutes to several hours. During this time, heart muscle tissue is actively dying. This is why emergency medical treatment must happen as quickly as possible. How often do heart attacks happen? In the United States alone, approximately 22,000 heart attacks occur every single day. That's roughly one heart attack every 40 seconds. How many heart attacks happen a year? Over 805,000 annually. In terms of how many heart attacks happen a day globally, the numbers are staggering. Cardiovascular disease causes millions of deaths worldwide each year.
Age factors. How young and old? How old do heart attacks happen? And how young can heart attacks happen? These questions surprise many people. The average age for a first heart attack is approximately 65 years for men and 72 years for women in the United States. However, heart attacks are increasingly affecting younger adults. Here's an alarming statistic. About 1 in 5 heart attacks now occurs in people aged 40 and younger. How young can heart attacks happen? While rare, heart attacks can occur even in teenagers and young adults, especially those with genetic conditions, severe obesity, diabetes, or who use drugs like cocaine. The risk of heart attack increases significantly with age because plaque buildup in arteries is a gradual process that accelerates over decades. Men face higher risk starting around age 45, while women's risk increases dramatically after menopause, typically around age 55. This is why regular cardiology checkups become increasingly important as you age. But don't assume you're safe just because you're young. Heart disease doesn't discriminate by age. If you have risk factors like high blood pressure, high cholesterol, diabetes, smoking, obesity, or a family history of heart disease, your risk increases regardless of your age. This makes patient education and early prevention absolutely critical for everyone. Silent heart attacks and sleep. How do silent heart attacks happen? Approximately 20 to 45% of all heart attacks are silent, meaning they occur without the classic dramatic symptoms. Silent myocardial infarction happens when the heart attack causes minimal or no symptoms that the person recognizes. You might feel unusual fatigue, mild indigestion, or slight discomfort that you dismiss as nothing serious. Silent heart attacks are particularly dangerous because people don't seek immediate medical attention. The heart muscle still suffers damage, increasing the risk of future heart problems, heart failure, and sudden cardiac death. Silent heart attacks are more common in people with diabetes, women, and older adults. How do heart attacks happen in sleep? And how often do heart attacks happen while sleeping? Research shows that heart attacks are more likely to occur in the early morning hours, between 4 a.m. and 10 a.m. This happens because of natural circadian rhythm changes in your body. During these hours, blood pressure rises, stress hormones like cortisol increase, and blood is more likely to clot. How often can heart attacks happen to the same person? Unfortunately, having one heart attack significantly increases your risk of having another. About 1 in 5 people who have had a heart attack will be readmitted to the hospital for a second one within 5 years. This is why cardiac rehabilitation and lifestyle changes are absolutely critical after surviving a myocardial infarction. Heart attack symptoms. What to watch for. Recognizing heart attack symptoms can save your life. The most common symptom is chest pain or discomfort, often described as pressure, squeezing, fullness, or pain in the center of the chest that lasts more than a few minutes or goes away and comes back. This is your heart muscle crying out for oxygen. But heart attack symptoms vary significantly, especially between men and women. Men typically experience the classic chest pain. Women are more likely to experience atypical symptoms, including shortness of breath, nausea, vomiting, back pain, jaw pain, or extreme fatigue. Many women describe feeling like they have the flu before a heart attack. Other critical heart attack symptoms include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. You might experience cold sweats, lightheadedness, or sudden dizziness. Some people describe a sense of impending doom, a feeling that something is terribly wrong. If you or someone near you experiences these symptoms, call emergency services immediately. Do not drive yourself to the hospital. Do not wait to see if symptoms go away. Every minute of delay means more heart muscle dies. Emergency medical teams can begin life-saving treatment immediately, significantly improving survival rates and reducing permanent heart damage. Prevention, protecting your heart health. Now let's discuss the most important topic, how to prevent heart attacks and protect your heart health. The good news is that up to 80% of heart attacks are preventable through lifestyle modifications and medical management. First, control your risk factors. High blood pressure, high cholesterol, diabetes, obesity, and smoking are the major contributors to heart disease. Work with your healthcare provider to monitor and manage these conditions. Take prescribed medications consistently. Drugs like statins, blood pressure medications, and aspirin can dramatically reduce your heart attack risk. Second, adopt a heart-healthy lifestyle. Eat a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, while limiting saturated fats, trans fats, sodium, and added sugars. The Mediterranean diet has been proven to reduce heart disease risk significantly. Third, exercise regularly. Aim for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity weekly. Physical activity strengthens your heart muscle, improves blood circulation, helps control weight, and reduces stress. Fourth, manage stress through meditation, yoga, adequate sleep, and social connections. Chronic stress contributes to heart disease through multiple pathways, including elevated blood pressure and inflammation. Fifth, avoid tobacco in all forms and limit alcohol consumption. Smoking damages your arteries and dramatically increases heart attack risk. Understanding how heart attacks happen is the first step towards prevention. Your heart works tirelessly every second of your life, pumping blood through thousands of miles of arteries and vessels. Protecting your heart health through knowledge, prevention, and early intervention can add years to your life and life to your years. Remember, heart disease is largely preventable. Know your numbers, blood pressure, cholesterol, blood sugar, recognize heart attack symptoms, seek immediate medical attention if symptoms occur, and most importantly, make heart-healthy choices every single day. Subscribe to Health Science 3D for more life-saving medical education. Share this video with everyone you love. This information could save their life. Next video, we'll explore the latest breakthrough treatments for heart disease and how modern cardiology is revolutionizing patient outcomes. Thank you for watching and take care of your heart.